Hello and welcome. Today I'm going to talk about some of the consumable devices that we use and some of the infusion pumps that we use them in. So we'll start with some of the consumables that we have here. All consumables tend to be sterilised by ethylene oxide, and so for that reason, even if they come assembled with three-way taps and extensions, it's always a good idea to ensure that these are tight so they don't fall apart on you when you're using them. The solute set that we use comes with a three-way tap and an extension. There's a 10 micron filter in the base of the chamber. It'll come with the roller tap open, so close the roller tap. Spike the bag, prime the giving chamber. These they've been engineered, so you can just clip that there and then just open the giving chamber, and then that will flow through. I would suggest tightening the tap onto the giving set and the extension onto the three-way tap. The ones that we use here have an anti-reflux valve, so that when you're in theatre, if you are aspirating and injecting, then there's no need to rotate the three-way tap again. It will just aspirating and injecting. There's no need to turn the three-way tap. And it won't reflux back up into the giving chamber. We currently use this as our blood giving set. It has some historical features on it. So the two-chamber priming set is a relic, I believe, of when we used glass bottles and needed an air inlet. And this is a ball valve. As we've been using bags since the 1970s, it's taken us a while, but we intend at some point in the future to remove the ball valve and just have a filter in it. Again, close the roller clamp, spike the bag, prime the chamber with fluid. Again, you can just put the extension set into the clip on the roller clamp and just open the roller clamp and allow the set to prime. Click end cap, so once the fluid has reached the end stop, it'll automatically stop. We've got a simple, because again all these are sterilised with ethylene oxide and all the connections are loose to allow the ethylene oxide to reach the parts that need to be sterilised and also allow the venting gas to purge it. None of this is secure, so always make sure that you secure all connections. Again, three-way tap is delivered with it open, so before you use it, make sure you turn it away from the three-way tap. On this set as present, there's no anti-reflux device in place, so just be aware that when you use the three-way tap, you'll need to rotate it to ensure that the fluids are directed towards the patient and don't reflux back up into the priming chamber. This is the B-Braun volumetric pump. We've got these throughout the organisation. You'll usually see them attached with one of these clamps. The important thing to notice on these clamps is that you've got two locking clips. If there's only one locking clip, then it increases the risk of the pump falling out of the clamp. The other thing that this clamp will allow you to do is that you can rotate the clamp on the body of the frame to give you a more usable piece of equipment. These also clip together, and I think the recommendation is that you can stack up to 3 of these devices together, and they just slide together and release, and you can see the channels. Okay. So we put this clamp on the pump, and then we mount it on the drip stand. Show you how to operate the device. So if you turn the device on, it'll go through a self-check. And then press the open button. So it says infusion line change, we'll go yes. Okay. And inside here you'll see the pumping segment. You'll have a few infographics on here that tell you how to use the device. This tells you that needs to be flashing. If it's not flashing, and you insert the clip, it will potentially sever the line. And likewise here, you've got two different shaped poles, and the important thing is to make sure you don't twist the administration set, otherwise it won't pump properly through the pumping segment. So take your administration set for this device, which is a B-Braun space line. And again, as with any consumable device, close the roller clamp first and foremost. You have an air inlet on the administration set and a filter at the bottom of it. Spike the bag, prime the chamber, attach the tubing into the roller clamp. So one of the important things on this device is to invert the pumping segment so that it fills from the bottom, so that you don't get air within the pumping segment. So prime this set. As you can see, this one doesn't come with a hydrophilic end piece, and the fluid just drips out the end. So we've got an oval and a round hole, so we just need to line these up onto the pegs, clip onto the attachment there, and then slide the green into the green. Pull these through the holes and close firmly. So this will now ask you to confirm that it's a space line, which it is, so press OK. So it now says we can open the roller clamp. We now can select the volume to be infused. So we'll select 1000. We'll select 1000. The highest volume we can select, maximum we're going to select routinely, is going to be a litre. I can see that for people having TPN, you might possibly want to select 3+ litres over a day. But for most fluid infusions that we'll be responsible for, it's going to be no more than a litre bag at a time. So, OK to confirm. So you can either set mils per hour, or you can select to deliver the bag over a certain time period. So you can do one or the other. Don't get confused and try and do both, because it'll just counteract and use the last one that's been set. So if we're going to administer this over 8 hours, then we're going to select 125 mils an hour. So again, you're going to enter the 1, 2, 5. If we press start, then it will start to pump. Along here is you can set the pressure, the occlusion pressure against which the pump will deliver against. So we can go into the options. So if you're pumping through a large peripheral cannula, then you want this set to the lowest, a low value. If you're pumping through a central line or a long tortuous line, then you may want a higher pressure selected. So the rationale for these is to try and reduce the risk of extravasation, but you're never going to remove that risk completely. So here you are, pressure. You can enter into that menu. So pumping pressure 1 corresponds to 225 millimeters of mercury, and as you sequentially go up the pressure up through these numbers, you get a higher pumping pressure that it will allow you to pump against. All the way up to 900 millimeters of mercury. And 4 should be a reasonable compromise number to select. Whilst we're on the options menu, there's other selections. The data block is not relevant. The bolus rate, again, not particularly relevant, but can set it if we want to. Keep vein open mode is active, so when it gets to a few mils left, it will switch into a much lower rate mode just to keep the vein open. And then you can select the alarm volume, 1 to 9. I won't go through it. If we press the C, that'll take us back to the previous menu. We can have bigger numbers. So you can see the numbers from a further distance. Go back to the normal size screen. And what we can do on here is we can do what we call a running rate change. So if you just press the button to enter the menu, I'm going to select that number, press OK, and just change the rate without having to pause the pump and enter the menu and then restart the pump. We talked about different ways in which you can select how you stop that. We talked about different ways in which you can select how to administer the fluid. So we've selected mils per hour. Another way of selecting it is over time. So the pump still thinks it's delivering 996 mils of fluid. So we can change, rather than delivering it over at 125 mils an hour, we can say we want a litre perhaps over 4 hours. If we start it now, it's recalculated the rate to 249.2 mils an hour because we already used some of the fluid within the bag. Important notes to mention when these pumps come from the wards is that it's important to pause the pump, close the roller clamp so that air doesn't get into the pumping segment or into the fluid line, because once you get air into the fluid line then it's very difficult to clear it and you end up with countless alarms. And hopefully if you follow those simple rules you shouldn't have too many problems with this device. Okay. To pause this pump when you don't want to use it, press the stop button. If you just leave it stopped like that, it will alarm constantly every few minutes. So just turn it off and it'll count down to turning off. You can cancel a standby. And it'll go back and then start it again, start it working. So for whatever reason, you've come to a point in the procedure where you want to remove this administration set from the infusion pump. To do that, you need to stop the pump, press the button to open the door, and it will say yes or no, so you're going to say yes. Open the door. Now you need to press this to release the clamp and then just pull it out. Make sure that you don't inadvertently pull this pumping segment out, so that can be done if you pull the pump out, pull the strip out the other way, then you can. And it takes some effort, but you can. Oh, no, you can't. In some of them you can pull it out, but if you follow the correct instructions and just pull it from, depress the green button and then pull it out this way, you shouldn't run into any problems. When you've done that, this can now just be used as an ordinary gravity set. So you can then just open that and it will just run as an ordinary gravity set rather than having to change and use another gravity set. But obviously, because it doesn't have any mechanism to prevent reflux, then if you're using it as a gravity set against an infusion pump, then you might want to consider an anti-reflux line. Okay. To remove the pump from the stand, depress the white clip, slide that down, and the pump can just easily slide out of the holder. Within the trust, the main syringe pump that we use is the Alaris GH, or Infusion, or BD, I think have brought them out now. So this is more or less ubiquitous throughout the organisation. There's a couple of exceptions which we'll talk about later. So we'll turn it on. And when it turns on, it tells you it comes from the equipment library, tells you what the date is, invites you to clear the setup. So we'll clear the setup. Now invites you to load a syringe. So the syringes that we use are Braun Omnifix syringes. So all these syringe pumps, or all volumetric syringe pumps, will can potentially have a range of syringe types within their library. And depending on where you work, some hospitals may have their libraries open, so you can select any number of syringes. We've locked ours down so that it only accepts Braun, or is calibrated only to use Braun Omnifix syringes. So what you'll notice about this syringe is that it's a Luer lock device rather than a Luer slip. So whenever you're using a syringe pump, you should always use a Luer lock so that the administration set doesn't inadvertently slip off the syringe and then fail to administer the drug that you want to give. What we use here is an anti-siphon valve. So all syringe pumps ideally should have an anti-siphon valve on the line, and you need to prime the line. What we have found with some devices is that if you tighten the anti-siphon excessively, then it can actually close the diaphragm and stop any fluid. This one, it doesn't seem to be doing that with, but with some of the total intravenous sets that we've got, we have noticed some problems with some of those devices, and we'll get to that later. Once you've decided that you're going to administer a drug to your patient, then you're going to need to complete a drug added label and fill the patient's details in and the drug details in the various boxes, and then attach that to the syringe. Much easier to do it on the flat than when it's wrapped around the syringe. Now you can think about how you want to fix these labels. You can just sort of put them over the top of the numbers so you can't actually see a number ever again, or you can try and line it up in whatever obsessive compulsive disorder way you want to do it. Next, load the syringe into the infusion pump. So open the clamp into the syringe holder, close the syringe clamp, take the plunger, disengage it from the gears, slide it onto the end of the syringe, and before you connect it to the patient, it's just asking us to confirm that it's a Beeper or normative fixed syringe, which it is. Rate lock, no. We'll show you how to cancel the rate lock later. Having placed the syringe into the syringe pump, you need to purge to make sure that the line is primed and that it's taking up the mechanical slack. Okay, so you can see the fluid coming out at the end of the line, so we know that the line's now purged and the device is taking up the mechanical slack, so that as soon as you press start, it will start to deliver the fluid to the patient. Having primed the line, we now want to set the infusion rate, so we press the up arrows, and that gives you course changes in infusion rate, and then press start. Do you want to lock the rate? No, commonly we don't, so press no. I think on the wards they often press yes, so it reduces the chance of patients or relatives interfering with infusion rates. As you can see here, this is just now currently infusing at 4 mils an hour. If we want to change the infusion rate, we have to pause the device, increase the rate, and press start. Well, let's put a rate lock on this time, so we'll press yes. And this means that when we pause the device, we can't easily change the value. So to get into the menu to unlock it, we need to press the question mark. We've got a selection of things that we can ask to do. So unlock the rate, which is okay. And now we can change the rate and then start the device again. These devices do not currently permit a running rate change. That's something that in due course we may unlock as a feature on these devices. As you can see, it tells you how much fluid has been infused, the volume to be infused, and what time period. Oh, sorry, you can set a volume to be infused, but that's not essential. And currently, this tells you that you've got 4 hours and 22 minutes left on the infusion. You can set different pressure limits. So if you've got if you're pumping through a larger vein, then a low pressure limit is appropriate. If you're pumping through a central line, then you might want to put a higher pressure limit on the device so that it's not alarming all the time, and just scroll up or down the keys to select the pressure that you want, and press the OK button here. And now return to the infusion menu. Okay. So if you want to deliver a bolus to the patient under special circumstances, such as you started an inotrope and you need to get the fluid through the central line to the bloodstream, then one of the options you can select is to purge it. This should only be done under very close supervision. So you can press the purge button, little bolus, and I would always advise that you keep close eye, because there will be a time lag from when the drug reaches the circulation until you see a change in blood pressure. So it's best not to start seeing a rise in blood pressure, because that blood pressure will just keep on rising. And then it continues on its infusion rate, and if it still hasn't reached there, then it may be worth bolusing giving another small bolus until you get the desired effect. So often when patients come to the theatres, they'll come on a glucose potassium insulin infusion, and they'll often have a setup similar to this with a couple of these are needle-free connectors on the end of the infusion line. They've got there's no added bonus features on these. They're just purely needle-free connectors. Whenever you connect any rolling around in the bed with the patient, standard practice to decontaminate the device with a chlorhexidine and alcohol wipe before you connect the consumable, or before you pierce the septum, or depress the septum on the device. So they should allow the chlorhexidine and alcohol to dry before you then engage the device, and ensure that you lock the lure slip the lure device onto the connector. So neither of these are anti-reflux. These are just pure needle-free devices. If you were to use a gravity set, then you should have an anti-reflux device in here so that you don't get pumping of fluid from the syringe pump back up a gravity set. But as we're using a volumetric pump here, then you don't necessarily need an anti-reflux line on here. If you don't have, if you have a gravity set, such as our blood-giving sets, which haven't got an anti-reflux line in them, then you may need to use an additional device, which is which is an anti-reflux valve. We've got a couple of devices currently in the organisation, one which is a B-Braun one like this, and another one which is a BD check valve as well. Hi, let me talk to you about the Alaris PK pump that we have in the trust. So whenever administering target controlled infusions, then you should be using a PK pump rather than trying to best guess it with one of the other infusion pumps. So as with the GH pump, you should turn the pump on. I'm reminded by this icon that ideally you should use these as mains powered pumps with battery backup. We have had instances where people have run it as a battery powered pump, and when the battery fails, and if you then plug the pump back in, then you'll have lost all the data, all programming data that's in there already. So if that happens to you mid-case, then it really is a bit of a disaster, and you then can't really carry on as a TCI case. It's then very much best guess as to what the infusion rate should be when you swap it over to a different pump. So ideally, as I say, use this as a mains pump with a battery backup. So these pumps can be used for target controlled infusions, or they can be used as a standard infusion pump. I would suggest that these are only ever used in target control mode, because the temptation is if you use it as a standalone standard infusion pump, then you continue that infusion into recovery, and then there's a risk that we then lose these pumps to a ward where they may not be aware of their special powers and properties. So with that in mind, we're going to say that we're going to confirm it as a PK pump and use it in that mode. TCI mode, yes. And then it gives you a choice of infusion models to use. Now, although this says new configuration installed, I do believe we've got a second remifentanil model, and you may need to scroll through not just this page, but there may be another page with another model on it. So select what drug you're using and which model you want to use it for. So we're going to say that we're going to use remifentanil infusion. So we're going to use a remifentanil infusion. We're going to select OK. And now to enable this pump to deliver the drug in the desired way, it's going to ask you a number of questions. So it's going to ask you about the dose. So check that you've actually making up your remifentanil solution to the solution that it recognises up here. If not, then adjust the concentration accordingly. But I think the standard is for 50 microgram per mil infusion. So we'll confirm that's OK. Enter the patient's age, and you can adjust the patient's age with the up and down arrow keys. You can just leapfrog with the big arrows. I'm going to press OK. Need to enter in the patient's height. Press OK. Gender for the patient, and weight for the patient. What you'll find is that it seems to be limited to 110 kilos. There's a number of patients that exceed that in this in-Stoke. And then, of course, you then enter into a debate about whether you should be using actual body mass or lean body mass for your calculations. So before you start using TCI techniques, it's probably a good idea to get to grips with the pharmacokinetics. So we'll press OK. And then it asks us to confirm the recipe that we've got. And the other options are to confirm whether you want to go for plasma target controlled infusion or effect site target controlled infusion. So we'll go for an effect site and press OK. So we now need to load the syringe. So as with the GH, it's a matter of opening the syringe clamp, moving the slide along, and then placing the syringe. So we've got some specific TCI administration sets. So this allows you to have three infusions. So remifentanil, propofol, metaraminol, and then your volumetric infusion. So I'm guessing we've got, what should I say, we've probably got blue for your propofol, pink for your inotrope, and white for your propofol. So did I say blue? Blue. Remifentanil, that's it. So let's put it, that's it. So put the remifentanil on there, prime the line. So if you want to prime the lines without being hit the patient. place the syringe in the syringe clamp, slide the plunger up. So we're going to confirm that it's a B-Braun Omnifix syringe. We're going to purge the syringe just to make sure that we've taken up the mechanical slack. Okay, we've done that. And now just confirm that, so now set the target that you want. Confirm that target. It will come up with a graph that will tell you how long it will take to achieve that, that desired concentration. So with the PK pumps, they deliver fluids at a much faster rate compared to the ordinary syringe pumps, and so when you press start they will run at up to I think 1800 mils an hour. So if we start that off, there you are, 500 mils an hour, sorry. So these can clearly deliver fluids much faster than ordinary syringe pumps to achieve the rates that have been predetermined in them. And it's going to achieve that effect site concentration over a minute and a half or thereabouts. If you want to change the rate on these devices, so we'll increase the effect site that you want to achieve, just change the number, press the green to confirm. And we'll then bolus the fluid, the syringe accordingly. And then slowly wait for the effect site to catch up. If you decide to decrease the rate, then again, you're titrating it down. You still need to press to confirm, otherwise it'll alarm. And now it's just going to enter a prolonged period of not infusing whilst it waits for the plasma or effect site concentration to decrease. And in the meantime, it's going to graphically display what the target is and potentially how long it's going to take to get there. When you come to the end of your case and you want to stop the infusion, then if you press stop, this will just hold it. It won't terminate the infusion. So to actually terminate the procedure and the case, if you go onto new in the query button, and it'll give you the option of ending the operation. So if you select OK and confirm, it'll then allow you to turn the pump off. Just going to talk to you a bit about the this pump. So this is a B-Braun syringe pump. Currently we use these in a couple of places within the organisation, predominantly as the PCA pump, and also these can be used, found as the infusion pumps in the MRI scanner where they're housed within a Faraday cage. So those are the only places where these pumps are in use where we'll come across them. So ordinarily, as a PCA pump, they come in a lockbox, but I've taken it out of the lockbox just to make it a bit easier to demonstrate some of the features on it. So we'll turn it on, just like we did with the space pump for the volumetrics. It'll go through a self-test. And the arm will then extend and allow us to open the door to insert a syringe. So we open the door, I'm going to pull this clamp out of the way, rotate it through 90 degrees, then we can put the syringe, which again is a B-Braun Omnifix syringe, into the syringe holder. We're going to make sure that the lugs of the syringe go inside the green retaining clip there. Oops. Close the door, and it's going to say B-Braun Omnifix syringe, and I'm going to confirm that it is a B-Braun Omnifix. And because this is advanced onto the syringe, it's taken up the mechanical slack and is ready to infuse as soon as you press start. I'm just going to say, do you want to use the drug library? So we're going to use this as a PCA pump, so we're going to say yes, we're going to use the drug library, and then you can select whether to use morphine or codeine. And what you'll see up here is this is a single dose PCA pump. So if you've got a patient that is receiving inadequate analgesia from a single dose PCA pump, then the only other option is to change it to a double dose PCA pump. We haven't opened up the programming on this to allow you to change rates on the ward. It's just left purely as a single dose. So we're going to say morphine. I'm going to press OK. change it? No, so you can't change it. It goes against the guardrails. You can change it to 0, you can change it to 1, but it will not allow you to advance it and increase it to any more than 1 mil. So we're pressing OK on that. It's going to limit you to 288 mils in 24 hours. So can we reduce that? We can certainly reduce it. Can we increase it? So you can't increase it to any more than that. So we'll press OK on that. The default is a 5-minute lockout. I suspect it won't allow you to give any less than a 5-minute lockout, again, or any more than a 5-minute lockout. So press OK for a 5-minute lockout. It's 50 milligrams in 50 mils, so 1 milligram per mil solution. I suspect we're not allowed to, we can try, but I suspect you're not allowed to run a background infusion, so you can't do that. You can set a volume to be infused. I suspect it won't allow you to set a time period. So it has had a lot of its functionality stripped out of it to just make it a PCA pump. So you may get called because the patient's experiencing failure to deliver the drug. So we'll go onto the options menu, we'll press OK, and you can change the pressure, the pressure that it allows you to deliver. So it'll be from 1 to 9, so it goes from 75 millimeters of mercury pressure all the way up to 900 millimeters of mercury pressure. Oops. 900 millimeter mercury pressure. So we'll select something in the middle, sort of 6-ish. Press OK to confirm. The only other things you can change are going to be the display intensity and the alarm volume. Other than that, not a lot else. Who knows? PC. So that's what the volume when they press the button. Okay. Ordinarily, PCA pumps will come in a lockbox like this, and the patient gets a controller. So just press the button to receive their bolus, and then proceed to give the bolus to the patient, and then lock out for the prescribed 5 minutes. The lockbox is locked with a key here. There's also a lock on the back here, so that you can lock these to the pole clamp so they can't be removed.